Shaka Zulu was a powerful African king and military leader who lived in the early 19th century. He was born in 1787 in what is now the province of KwaZulu-Natal in South Africa. Shaka was the son of a minor chieftain, but he quickly rose to prominence in his tribe due to his bravery and military skill. He joined the army of Dingiswayo, a powerful regional king, and quickly rose through the ranks. Shaka eventually became the commander of Dingiswayo's army and helped him to conquer many neighboring tribes. When Dingiswayo was killed in battle, Shaka took over as the leader of his tribe, the Zulus. He immediately began to implement a series of military reforms that would turn the Zulus into one of the most formidable fighting forces in Africa. Under Shaka's leadership, the Zulu army became highly disciplined and organized. Shaka introduced a new fighting formation known as the Bull's Horn Formation, which involved surrounding the enemy on both sides and attacking from the rear. This tactic was highly effective and helped the Zulus to win many battles. Shaka also introduced new weapons and tactics, such as the short stabbing spear and the chest and horns formation, which involved the warriors forming a chest that would engage the enemy head-on, while the horns would encircle the enemy and attack from the sides. The Zulus quickly became the dominant power in southern Africa, and Shaka continued to expand his kingdom through a series of conquests. He also implemented a number of social reforms, such as forbidding the killing of women and children in battle, and establishing a system of merit-based promotion in the army. However, Shaka's rule was also marked by cruelty and brutality. He was known for his harsh treatment of his enemies, and his own people lived in fear of his wrath. His rule was also marked by a number of violent purges and executions. In 1828, Shaka was assassinated by his half-brothers, who feared his growing power and tyranny. However, his legacy as a military leader and nation-builder lived on. The Zulu people continued to follow his military tactics and traditions, and his influence can still be felt in South Africa today.
Shaka Zulu was killed by his half-brothers Dingaan and Malangana in 1828. The exact circumstances of his death are not known for certain, but it is believed that Dingaan and Malangana plotted to assassinate him because they were afraid of his increasing power and feared that he would kill them. According to some accounts, Shaka had ordered the killing of his own mother, which had angered Dingaan and Malangana. They conspired with some of Shaka's trusted advisors to carry out the assassination. On the morning of September 22, 1828, Shaka was taking a nap in his military barracks when Dingaan and Malangana arrived and attacked him with spears. Shaka fought back fiercely, but he was eventually overpowered and killed. After Shaka's death, Dingaan became the new king of the Zulu nation, but his reign was marked by instability and conflict. He was eventually overthrown and killed by another of Shaka's half-brothers, Mapande, who went on to become a successful Zulu king.
A stab wound is a type of injury that occurs when a sharp object, such as a knife, scissors, or broken glass, penetrates the skin and underlying tissues. Stab wounds are a form of penetrating trauma and can cause damage to muscles, blood vessels, nerves, and internal organs, depending on the location and depth of the wound. Stab wounds can range from superficial to life-threatening, depending on the severity and location of the injury. Superficial stab wounds may only affect the skin and can usually be treated with basic first aid measures such as cleaning the wound and applying a bandage. However, deep stab wounds that penetrate vital organs or major blood vessels can be very serious and require immediate medical attention. Stab wounds can be accidental, such as when mishandling sharp objects, or intentional, such as in cases of assault or self-harm. In either case, it is important to seek medical attention promptly to ensure proper treatment and prevent complications. When you have a stab wound, your body reacts in a number of ways. The specific effects depend on the location and severity of the wound, but here are some general ways in which a stab wound can affect the body. Stab wounds can cause bleeding, which can range from minor to severe depending on the location and depth of the wound. Severe bleeding can be life-threatening and requires immediate medical attention. Stab wounds can penetrate deep into the body, causing damage to organs and tissues. Depending on the location of the wound, this can lead to serious complications such as internal bleeding, infection, and organ failure. Stab wounds can be very painful, particularly if they are deep or in a sensitive area of the body. Pain management is an important part of treatment for stab wounds. Severe stab wounds can cause shock, a dangerous condition in which the body is not getting enough oxygen and blood. Symptoms of shock include low blood pressure, rapid heartbeat, and shallow breathing. Stab wounds can become infected if they are not properly cleaned and treated. Signs of infection include redness, swelling, and fever. Stab wounds can leave scars, particularly if they are deep or require surgical intervention. In summary, stab wounds can have a number of effects on the body, ranging from bleeding and pain to organ damage and infection. Seeking prompt medical attention is important to minimize complications and ensure proper treatment. Managing a stab wound requires prompt and appropriate medical attention. Here are some steps that can be taken in managing a stab wound. If the wound is deep, bleeding heavily, or located in a critical area such as the chest, abdomen, or neck, call for emergency medical help immediately. If there is bleeding, apply firm and direct pressure to the wound using a clean cloth or gauze. Elevate the affected area if possible to help slow down the bleeding. If the wound is relatively small, wash the area around the wound with clean water and gently clean the wound with mild soap. Do not scrub the wound, as this can cause further tissue damage. Once the wound is cleaned, cover it with a sterile bandage or dressing to help prevent infection. Change the bandage regularly or as directed by a healthcare professional. Even if the wound appears to be minor, it is important to seek medical help to ensure proper care and management. A healthcare professional can assess the wound, clean it properly, and prescribe any necessary medications such as antibiotics or painkillers. It is important to note that if the stab wound is located in the chest, abdomen, or neck, it is best not to attempt to remove the object or probe the wound, as this can cause further damage. Instead, seek immediate medical attention.